Hi class. Today I want to talk about radiology workflow analysis. More than ever before, radiology directors are being asked to provide data-driven decisions and to provide statistical evidence for capital requests, staffing plan changes, and financial initiatives. When a radiology director needs analysis, he or she turns to the radiology informatics team. Understanding workflow analysis is another way to be the best candidate for the job. So here are some common radiology business analysis studies you may be asked to do. One is equipment utilization. Having the latest or most up-to-date MRI or CT equipment is critical for your hospital. But to get the most out of the machines, you must know to what degree you're using them. You may be asked if your department has too much or too little equipment to meet the demands of your patient volume. Is one machine being used a lot? Are patients waiting a long time? Either way, you could be losing business, so you have to find a way to quantify how your equipment is being utilized to know if you're making effective use of time. The most likely time you will be asked for an equipment utilization study is when submitting a capital budget request for a new piece of equipment. You will need to show statistical evidence for that new CT scanner in the ER. So that's one report you'll have to create when the radiology director comes to your office and says, "Hey, I need to get this data together. I want to buy a new CT scanner." That's something you'll get involved in as a PACS administrator. Personnel utilization. In addition to maximizing your equipment, it's also helpful to monitor how efficiently the technologists and radiologists are. There are production benchmarks for technologists and radiologists. In other words, technologists are expected to produce a certain amount of studies in a day, and radiologists are expected to read a certain amount of studies per day. You may be asked to provide monthly reports to make sure everyone is working close to 100% capacity. So some thoughts for you to consider. What factors affect personal production? Do radiology departments typically understaff or overstaff? The most likely time you will be asked for personnel utilization data is when the radiology director needs to make adjustments to staffing. Scan follow-up. Currently, radiologists literally read whatever history is available, interpret the images, make recommendations, and move on to the next case. Only mammography tracks the recommendations, follow-up care, and radiologist callback rates. More and more facilities want to know how the recommendations impact patient care and which radiologist has the highest callback rate for all modalities, not just mammography. So this is another report you may be asked to create. How many callbacks are we having for different modalities, different physicians, right? So if you don't know, a callback is when they have to call the patient back for additional images to help get the diagnosis for that particular study. Peer feedback. All practitioners, even those who have several years of experience, can benefit from hearing what their peers think about their work. One advanced analytics tool bridges business and clinical needs, allowing the radiology peers to give feedback about the quality of their colleagues' study, their use of radiation dose, and how well they center patients for studies. At the University of Maryland, this tool has helped the radiology department identify sections with longer turnaround times and practitioners who take longer to report findings. It's also helped departments improve how they use all modalities. Peer-reviewed statistics are required for accreditation for the CT mammography equipment. Typically, it's the PACS admin who keeps track of those records. So, peer review, we'll talk about it next semester in depth, but that's another place where you may have to do some data mining. Radiation dose. Limiting radiation dose has been an industry-wide concern for several years, but measuring and tracking it through clinical analytics is relatively new. In addition, there's legislation that requires including radiation dose in imaging reports, and it started in June 2017. Consequently, the challenge for PACS admins is to find a way to automate the collection of this data and import it directly into the report template. And of course, any data that you're collecting and sending out to your customers, somebody's going to want analysis of that data. Somebody's going to want to identify trends and do things based on that data. Scheduling patients. Multi-site practices could benefit greatly from an analytics program that tracks which sites are least utilized. Appointment schedulers can use it to direct patients to the site with the shortest wait times and least utilized equipment. The patient, all things being equal, should go to sites that are the most advantageous for the institutions. Practices can build this tool into their scheduling as a way to preferentially push patients toward equipment that is least utilized. Of course, nobody wants to drive across town for their CT scan. Everybody wants to go to the closest imaging center, but if the closest imaging center is the busiest and they have to wait 3 months, well, maybe they would be willing to drive across town if they can get that scan 2 or 3 weeks from now. So you have some equipment that tends to be heavily utilized and some that is less utilized, and ideally you want to balance that out. So again, you need an analytics methodology, some sort of data mining, to know how many patients are being scheduled at this site versus how many patients are being scheduled at that site. All of this data mining, all of this workflow collection stuff is usually things that PACS admin gets involved in producing these reports. So healthcare is really just discovering business analytics. It's tough to solve a problem you don't know you have. Every radiology department is feeling the pressure to reduce costs and improve turnaround time, but how does an administrator pinpoint problem areas that prevent the department from reaching efficiency goals? Business analytics, which leverages data and graphical visualizations to identify workflow issues and drive evidence-based modifications to organizational processes, provide an answer. Tools can be delivered by vendor-created dashboard software or homegrown applications built into IT systems. The goal is informed decision-making based on an empirical view of performance rather than anecdotal evidence. And I'm so happy to tell you, if you didn't hear, just last week we purchased the business analytics software for our AGFA PAC system, and over the next 6 months I'll be creating a class specifically in business analytics. Currently